Good morning, everyone. I think it's 11 o'clock, so I think we'll get started. Thank you for coming. This morning, we heard Dr. Hasenbuehler talk about stigma as a multi-level construct. I know certainly I've experienced stigma in my own life. I'm pretty sure everybody in this room has it in one form or another. And in my current practice at an HIV clinic out in Surrey, quite a wide variety of patient groups, HIV patients, and I see firsthand the effects of stigma on their lives and on their care, on their health. So I'm very interested in hearing what our speakers have to say today on the topic of strategies in prevention and care to impact stigma. We have three sets of speakers, and first up are J.D. Cossar and Andrew Beckman. J.D. is the PLDI and Stigma Index project manager at Pacific AIDS Network. He's a runner, a Saskatchewan expat, West Coast obsessed, local history nut, nerd for sociology theory, uncle, and godfather. He's got quite a resume. JD's been an active contributor in the nonprofit sector for a number of years, with several years' experience in nonprofit program administration, implementation, and youth work. As a peer support advocate, assisting youth with the reporting of hate crimes and providing follow-up support with services with Fraser Health. Working with Youth Quest, Lesbian and Gay Youth Society of British Columbia, a youth-centered network of drop-ins, as well as on a crime prevention support program with the Attorney General's Office. As a program facilitator for the Vancouver Coastal Health Authority, JD educates teens in order to promote sexual health. Currently, JD sits on the board of directors at Positive Living Society of BC. He's actively engaged in the community in a number of facets as an open and honest HIV positive person. Thank you, JD. And I'll introduce Andrew too, because they're going to kind of do a tandem thing here. So Andrew Beckerman, we all know Andrew. Been around for a while. Hey, Andrew. HIV positive since 1980. Was saved by a lucky place in the first Crixavan trial in November of 1995. He immigrated to Canada in 2005. He is a reception volunteer at AIDS Vancouver Island and past chair of its board, a board member of the Pacific AIDS Network, and serves as board vice chair and fund developer at the Canadian HIV/AIDS Legal Network. He works at the intersection of many 21st century Canadian challenges, assisting neighbors addressing stigma, poverty, homelessness, mental health, and addictions issues, infection, despair, and social injustice. He was awarded the United Way of Greater Victoria's honorary lifetime membership for 2015. Please welcome these two gentlemen.
Well, thank you very much for attending our little bit of Undoing Stigma. It seems apt that we're here presenting the Stigma Index as a tool, as more than a tool, as a capacity building engine for the HIV community. I'll say community a lot. I think if we wanted to personalize it just a bit, I didn't start living until I was joined up with my community. After my HIV diagnosis, I had all those issues of internalized stigma. That internalized stigma didn't end for me until I joined my community and started to feel supported. As we know, the LGBTQ community has been one of the communities in the forefront fighting against the HIV/AIDS epidemic. They have advocated for essential human rights, from the very basic around housing and social welfare needs, as well as legal and social justice. Communities really remain one of the strong and most pivotal points to address the HIV/AIDS epidemic.
So our study here in BC is part of a international effort on mapping stigma and HIV. We have a multi-talented team of collaborators who have to meet at a fairly rigorous teleconference schedule like every 2 weeks. How do we sign up for that? But there's so much work to get through to getting this survey going. And each of our team members brings unique talent, I can't say to our table, they bring it more to our telephone. And we struggle. It's very hard to find the time to do this work. I'm retired, it's easiest for me. I think everybody else on the committee, with one other exception, is still actually working. And the demands on our time, because we're a group of people who can't seem to say no, seem to be ever expanding. And it's a group of people who are HIV positive. It's a group of people with research backgrounds and knowledge and skills, partnership development folks, community engagement folks, service and program delivery folks. And this will be, the results of this survey will hopefully guide implementation of a conversation that will lessen the incidence of stigma in our lives. And we're doing this. We're actually ahead in BC. This was to be part of a national Stigma Index project, and we're actually the only ones that are currently funded. We got a very wonderful grant from the Vancouver Foundation with support from the Canadian Institutes for Health Research and REACH 2.0. We have partnerships with the AHA Center, YouthCo, Positive Living BC, and GNP Plus North America. It's a big effort, and you may hear from us when we're starting to actually do the survey.
Thank you. Stigma is something that really is very personal in many ways to each of us. But also, if we expand that out, as we just saw from the keynote speaker, it also can be structural. Some of the team members you'll see in the room have just finished passing out some pieces of paper and marker. And what I would encourage you to do, what the team wanted us to do, was have a conversation with the audience here. And of course, that's not always possible due to time. We would like to continue the conversation really by asking you what stigma is to you. And that's, we provided you with a paper and a marker or a pen. And we'd like you to put down, as you watch our video, we'd like you to put down what stigma is to you. If that's a drawing, if that's a word, if that's a sentence, it's important because it is part of the conversation. Stigma is really that thing that we're all so scared of happening to us, and yet many of us do it to members of our community and ourselves. Stigma arrives unannounced, but when it does, you really feel that isolation.
To me, stigma is really about creating a situation in which some people are seen as less important or less valuable than other people, and then teaching those people to act as if, or to believe that they really are less valuable than other people.
Stigma means to me living a lot in isolation and not being able to live your life fully, and always afraid of what people might think of you.
Stigma is a word that means exclusion in a social interaction, and it leads to lots of things that are very negative for both people that are experiencing it, but for particularly the person who's on the receiving end of the stigma.
I think of the isolation that you feel.
Something that isolates us, keeps people from really understanding each other.
That you would kind of have to stay in a bad situations. It's easier to are harder to get out of if you're being stigmatized.
When we have stigma happening, we just decide it's not even worth a conversation. It's something we don't want to learn about.
The first thing that stigma means, and probably is most important to me, is exclusion. So if you are excluded in any which way, you're not part of the social fabric that you feel you should be belonging to.
Stigma, in my opinion, is a lack of knowledge, which forms the basis of discrimination.
So when all of you are finished with the little conversation piece we asked you to do, if you could just pass it down to the right, your right, and we'll collect those.
And we're actually going to collect them and put them up in the lunchroom so that they're there for people to think about as we're dining, to just sort of expand the conversation. The people living with stigma, HIV Stigma Index, it's a unique survey, is a unique research tool because it quantifies and makes record of discrimination of people actually living with HIV and its impact on their lives. We're in process of working off of an international model, adding questions that reflect local nuances in our province. And the results will be a real tool for empowerment. It's a program that's designed by and for people living with HIV and to document their experiences. It has two key aims, the first being to increase evidence base for policies, programs to reduce HIV-related stigma and discrimination, and to ensure that people living with HIV, their networks and their local communities are at the center of this research and the response to stigma, and giving people whose voices may not be present in a room like this a chance to have their say.
I'm going to use the word proud a lot because I'm extremely proud that we can bring this stigma index back from the global sense back to our province. So far, the index has only been implemented in 3 other North American sites, and we'll talk a little bit more towards the end about the numbers, but in those 3 North American sites, BC has quite a large sample population, and this is something that we should be proud of. We're not just sticking to Vancouver specifically. It's a provincial-wide study, and while that poses challenges for us, it also means that we'll be collecting a larger breadth and width of knowledge from HIV-positive people who are experiencing stigma. The index itself has been implemented in over 50 different countries. It's been translated into 54 different languages. And really aggregated all together, it's one of the largest studies that speaks to the experience of HIV discrimination and stigma to date. It's really going to be the go-to instrument in the future, and currently right now, when policymakers, community groups, and other stakeholders are looking at the impact of HIV-related stigma. So again, you're going to hear me use community quite a lot. Community, as I said before, is one of the highly and most important aspects of the Stigma Index overall. Community-based research, as I said before, is a highly collaborative approach. We really respect the values and contributions and expertise of all of our team members. In the research process itself, the research process itself is a form of social action. It advances the knowledge and skills of all stakeholders, not just HIV-positive people, but also their allies and the academic researchers that are involved in the process. Based on our experience with community-based research process, we have identified the following critical components that are important for building CBR that's effective and helpful to the community. Within the response to HIV, one of the most important things is that community and communities have moved from being objects of research to being the researchers themselves. And what that means is we can contextualize the information and knowledge that we have in the HIV community to make it relevant to our experiences and our lived lives. Really, the peer-led study that is the Stigma Index ensures that all of the results that we will have are 100% reflective back.
So these are areas that we're looking at. As we've mentioned, this is the first in Canada. Interestingly, I thought that the US was rolling it out. The United States is actually rolling it out on a city-by-city basis. We're actually doing it here in Canada on a province-by-province basis. And the application for national funding is actually due tomorrow, I think. Monday, okay. So hopefully we'll see this in other provinces. One of the goals is to measure the resilience of people to stigma, and specifically that stigma related to HIV. And again, this data, and I have no education in this field, I've never done any research except peer-driven research. When I started on the food security survey, I thought, why are we doing this? We know people are hungry, but it's the data that we've collected on that survey that's going back into the community and going out to policymakers throughout the province that hopefully will put more food on the table of people, which is necessary for survival if you're living with HIV. And in this case, as I said in my little clip, education. The more we can educate people and get people comfortable about speaking about how stigma affects them, the healthier community we're going to have. And in the case of HIV stigma, it's a little bit different in that non-disclosure can result in charges of grave sexual assault. We're lucky here in BC, the incidence of cases is relatively low. You couldn't say that about Ontario. And despite the fact that I've been undetectable for 20 years, I couldn't infect anybody if I wanted to. That kind of scientific evidence was not, although presented at the Supreme Court, which made a decision in 2012, it was actually not taken into account. And there have been cases in this country and around the world where people have not disclosed, the person they have not disclosed to has not become infected, but the person who didn't expose ended up in jail. And we want to make that probability go away.
So we'll kind of speak to some of the science behind the index itself. The BC people living with HIV Stigma Index, we hope, will provide examples of stigma that we can take back to policymakers and address issues that Andrew was talking about. So you can see up there the different areas that we'll be looking at, and how we think this may be relative is that we might want to look at resiliency instead of just the stigma aspect of it. How has the gay community and other communities historically fought against stigma within their own community, and how can we learn from that? So study interviews and data collection. Study participants were looking at an overall sample population of about 300. And what the important part of the index will do is it'll be 2 HIV positive people doing the index together within that. So that's a really important aspect. We will be pulling from different community organizations throughout the province, as well as PAN's Pacific AIDS Network, 50 member plus organizations. So just very quickly, when I was thinking about where the team is now, I was impressed by how much we've done just in the last 6 months. We've worked with academic partners to provide a provincial-wide sampling strategy. We've come up with our own BC Stigma Index logo working together. We've produced 3 videos. We've done a process evaluation. We're currently working on augmenting and making the index specific to BC and to reflect our realities, as well as working on our very last submission to ethics. So in those last short months, we have been working collaboratively with the team, learning from each other, and giving this back to the community. So a lot has been done in 6 months.
As I alluded to earlier, this is not an easy process. It requires a lot of input from a wide variety of people. And we're missing key players around our table. And it's not that people aren't interested from those communities, it's they have so many demands on their own time as well. But it's wonderful that we can perform a connection between academically trained researchers, statisticians with big computers, and the input from people living in the community, providing real data, and having that conversation in a setting with a peer that if you have nothing else in common with, you're HIV positive together.
So quickly, some of the lessons learned, as you see, is that BC is an expansive province. So just dealing with geography has been hard to get team members to the steering committee itself. And also one of my biggest problems as being a manager for the project is taking away barriers so people can participate equally. Small things like cell phone access or computer access are a big thing. So these are some of the challenges that we've been working with. Thank you very much for your time today, and we would love, love, love to continue the conversation on the break. Come see any of our team members, as well as please visit our website. Check out our other 3 videos. Thank you very much.